So doctor, real quick, if you could introduce yourself for our patients, just for the benefit of patients, your background and what do you do here at Max?
Well, I am Dr. Kulbhushan. I am the director of Pediatric Cardiac Surgery. What we basically do is that we sort of mend children who have heart defects which are sort of congenital in nature, and this would also include a large subset of people who have sort of grown up, have had previous cardiac surgeries, and what we call as the gooch.
Okay.
Um, so as far as my background goes, I mean, I've trained in general medicine, then went on to do my general surgery, MS in general surgery, and then further went on to train in cardiac surgery. I've had an overseas exposure. I was working as a specialist registrar at Great Ormond Street, London, and I've been associated with Max now for close to about 3 years. As a unit, we perform about 500 to 600 open hearts on a year-on-year basis, and we have results which are comparable to best centers in America and Europe. And we are sort of geared to provide for surgical as well as interventional care of the whole spectrum of congenital cardiac anomalies which can exist across the board.
In terms of your international patients, which countries do you predominantly see traveling to India?
Well, on last count, we had patients coming in from about 28 overseas countries. The majority of the load probably would be from Afghanistan, Middle East, and the neighboring countries, which would include Bangladesh, Nepal, and Pakistan. We've had people coming in from as far off as Colombia, and we do have a lot of people coming in from Guyana. So, yeah.
So in terms of the patients traveling, what is the main reason that they come to India for this particular treatment? Is it the lack of infrastructure and the doctor's
I would say it is both the lack of infrastructure in the parent country plus the expertise which is available. And I think the most important thing is that India is now an established hub for the management of children with cardiac defects. And I think what needs to be taken note of is that we are able to provide the same standards of care as America or Europe at about 1/6 or probably 1/10 the cost, which would be sort of incurred if the same was done in Europe or in America.
Okay. And how long typically does the surgery take, and how long does the patient have to stay in the hospital?
That will actually depend on what is the underlying defect that we are dealing with. If it's at the sort of non-complicated end of the spectrum, like an AST, which is a hole in the upper chamber of the heart, then from the time of coming into the country to the time of discharge, it will take anything from a week to about 10 days.
Okay.
For the more complicated ones, would depend basically on what is the length of stays in the intensive care period. So here, if you go by thumb of rule, the average is about 10 days to about 2 weeks.
Okay, fantastic. Thank you, doctor. Last question. In terms of what are the typical inhibitions of a patient coming to India, especially relating to surgeries or the complications associated, and especially basically your team and your unit here, what have you guys done to basically calm those nerves down, sort of the complications that can be available?
Well, I would tend to disagree with you in the sense that as of now, I don't think probably there are no inhibitions as such. What is sort of important is that there is a lack of awareness.
Right.
So what one basically would need to do is that one needs to spread awareness regarding the capabilities and the infrastructure support which is available to us at Max. We've done that very successfully in a number of overseas countries, and we now actually have tie-ups where we get patients on a regular basis. So it's a hospital-to-hospital tie-up. I don't think there are any sort of major barriers now to movement of patients from overseas to India.
Okay, perfect. I think that would be
great.
Thank you very much, doctor. Thanks.
Thank you.